Good morning, my name is Abigail. I'm a fifth year medical student, and you'll also be hearing from Leah, my colleague. She's also a fifth year medical student. And we're going to speak to you about Parkinson's today. So you might have seen some older people usually in your community struggling to walk, struggling to speak, struggling to do their daily activities. And there's many reasons for this, but one of them can and might be Parkinson's. So you might be asking yourself, what is Parkinson's? I've never heard about this before in my life. Well, Parkinson's originates in your brain. So I can show you, here is a nice picture of the brain, and here's the substantia nigra, a small part located in the lower part of your brain. So what happens in Parkinson's? So in your brain, there's a chemical that works. It's called dopamine. And this chemical is amazing because it helps you initiate movement, but also make movement smoother and faster. It's like the oil in your car, allowing you to drive nice and smooth on the road. But what happens if your body doesn't have any dopamine or is not making dopamine as it should be? Well, first of all, your movement's slow. You struggle to initiate movement, and your movements become irregular and stiff. So yeah, that's basically what happens with Parkinson's. You have a decrease in dopamine, this chemical in your brain, and suddenly there's a change in your general way of functioning.
And it affects something like a chemical mo body.
For regenity ke bolela ka batho ba ba nang le bolwetse ba go thathasela motho wa teng o ka re o tshwere ke marapo mara ha tsamaya ha khone go tsamaya wa thathasela bolwetse bo bo khosa ke brain bo khosa ke ho nna le bolwetse ba tlhogo ba o affecta o felletsa o palla go tsamaya o thathasela ne ke khopela gore le ka tla mo tleliniking la be itlhagisa ba la alafa bolwetse bo.
A for akinesia, I mavabyi ya milenge, I mavanga ku ri u tikeriwa hi kusuka u yima, swi vanga ku nakambe ku ri loko u famba movement ya wena yi va leyitsongo.
Person change and uyema so and then ubuye udule so.
So as you just heard from our lovely patients here at Rosslyn Clinic, there are 4 common symptoms associated with Parkinson's. We can use this acronym to remember them. TRAP, spelling trap. So let's start with the T. The T stands for tremor, which basically just means shaking of your limbs. So usually we see in Parkinson's the shaking of the hands at rest, and it's usually called a pill rolling tremor because it looks like the patient is rolling pills in their hand. Secondly, we get to the R, which means rigidity. That's basically stiffness in all planes of movement. So you could possibly be looking after somebody who has Parkinson's, and you'll see that they might be struggling to move their limbs as well as they used to. It's usually stiff and difficult. Next we get akinesia. Akinesia is a difficult word, but it basically just means no movement. We can also use bradykinesia, which means slow movement. This will present in the person you're looking after as struggling to start moving, or walking very slowly, or when turning a corner, freezing in their walking. Lastly, we have P, which means a postural change. So usually when you have the person you knew walking upright, looking bright every day, suddenly their posture might become very stooped and they might struggle to move and function normally. So what is the treatment for Parkinson's? While there's no curative treatment, there is some things we can use to help alleviate the symptoms of Parkinson's. As Parkinson's is a disease where there's a decrease of dopamine in your brain, it makes sense to replace that dopamine with some medication. What are some medications you can come across while caring for your loved one? Well, the most common and the most important one to remember is levodopa. This is basically just dopamine that you give to your loved one, and this will replace the dopamine that they don't have in their brain anymore. There are many other medications. Some common ones are also dopamine precursors, or medications that stop molecules from breaking down dopamine in the body. But you can ask your local pharmacy more about that when necessary, or the doctor treating you.
Common non-motor symptoms your loved one can experience are depression or anxiety, sleep disorders, hallucinations, anosmia, which is the loss of sense of smell, and constipation. The cause of Parkinson's is based on a multi-hit theory. Environmental triggers, aging, genetic factors, and structural changes to the brain can altogether lead to the development of Parkinson's. Deep brain stimulation is a surgical process whereby electrodes are planted into certain areas of the brain to deliver electrical impulses which regulate brain activity. Supportive therapy consists of a multidisciplinary team comprised of a speech and language therapist, psychologist, occupational therapist, and lastly, a physiotherapist, because if you move more, you live more. Your loved one may have lived with Parkinson's for up to 15 to 20 years without it being diagnosed. It is a progressive disease, meaning that it will get worse over time. The speed of progression may vary from person to person.
We understand that it might be difficult to care for somebody or live with somebody who has Parkinson's. We hope this video helped you to understand it better and even maybe give you a glimpse of what it is like to live with Parkinson's. Here's some tips, maybe just to help you around the house and just interact better with your loved one who has Parkinson's. Parkinson's affect the way we think, we feel, and move around. In terms of communication, it might be good just to learn to take your time and be patient with your loved one. They may not be able to speak as fast as they used to and take a little bit more time to get to the words they want to say. But do encourage them to keep talking, as we don't want to silence the ones we love. In terms of emotion, regularly check in with your loved one. Depression is common in Parkinson's, and we want to pick it up early. Help your loved one to engage in hobbies and activities they previously enjoyed, or even join a support group. Also help them to remember their doctor's appointments and go regularly. Physical activity is always good for our loved ones. Keep them walking and active and help them do the exercises as prescribed by the physical therapist. And last but not least, it's very important to keep a regular schedule. This helps our loved ones to be less disorganized and know a little bit more about where they are and what's going on.
Additional practical tips for around the house could include eliminating any tripping hazards such as mats or clutter. One can also install grab bars in the bathroom, around the shower and the toilet, and by raising the toilet seats and installing sturdy chairs in the living room can also help with preventing falls. And another important aspect of the house is to have adequate lighting to ensure that your loved one does not trip or fall and cannot see.
All the best for taking care and living with your loved one who has Parkinson's. Please also get the support that you need when you feel burnt out or weary.